All right, this is a live look at a tracker of all the cases of the new coronavirus confirmed worldwide. Right now, there are more than 120,000 confirmed cases, 4,600 deaths, and more than 68,000 people recovered. We told you the White House has put some new restrictions in regards to travel in place this week to try to prevent the spread of this disease. The latest confirmed case in Ohio, we told you, involving a person with no travel history.
So this morning, we are joined by Dr. Keith Armitage from University Hospitals we want to talk about community spread, and we also want to talk, doctor, about what do you do, first steps, if you think you might have it, you might be sick.
Sure. Community spread means that we're seeing cases of people who didn't come from an area, traveling from an area where the virus is present from a cruise ship. This has been happening in Seattle for about 6 weeks. It's been happening probably in New York suburbs for a few weeks. And now that we have some cases in Cleveland, I think were imported, we may start to see community spread. If people think they may have coronavirus, if they have a mild illness, they should probably just isolate themselves.
Okay.
But what they shouldn't do is go to the doctor's office or go to the ER without calling ahead. It's critical that people, if they're going to seek care and they think they have coronavirus, call ahead so they can put a mask on. Or a lot of ERs will test somebody outside the ER so they don't come in the ER and contaminate other people.
Containment is really important right now.
Right.
Talk to us about what is the public health objective, the medical objective with the social distancing, the social isolation, canceling these big public events that we're seeing, a lot of people working from home, schools closing down for a while. What is the medical objective there?
The short-term goal with this epidemic is to slow down the spread. I mean, long-term, we want to eliminate it, get a vaccine. Short-term goal is to slow it down. People in the medical profession see what's happening in northern Italy. It's bad. The healthcare system there is getting overwhelmed because it spreads so fast. We need to slow down the spread. People need to take seriously this idea of social disaggregation, of social distancing. We shouldn't have events of more than 25 people. No banquets, no dinners, no social events. People should spend time with family and friends, but people need to take it seriously. The great majority of people, say, who would go to March Madness would not get sick.
Right.
Young adults, kids are not dying of this disease, but they're part of the spread, and they spread it to the vulnerable. And this is what's happened in northern Italy, and it's really put a massive strain on the healthcare system. We need to slow the spread so that does not happen here.
We do not want to overwhelm our healthcare infrastructure is really the goal with this.
We need to slow it down, absolutely.
And then finally, what is the end goal with that? Are we trying to starve the virus of hosts, of people who it needs to survive? Or what is our ultimate goal here with this strain of the coronavirus to get this to come to an end? Right.
In the short term, slow the spread. If we can slow it enough, maybe we can keep it from spreading, and then we'll get a vaccine. And whether a vaccine is highly optimistic, 6 months, 8 months, a year, long-term vaccine is the key. Before we get a vaccine, slow it and see if we can stop it.
Do we think it might possibly be seasonal, that we might see it start to slow down
I
in
think,
the summer, or is it too early still to know any of those facts?
See, I think it's optimistic because it's spreading in areas where it's summer now. I don't know if Tom Hanks was in Australia.
Correct, yeah.
So, it may help a little bit, but I don't think we can rely on that.
And your final note to folks?
Take it seriously, slow the spread.
Okay. All right. Dr. Keith Armitage, infectious disease specialist from University Hospitals. We always appreciate your time hearing it right from the source. We appreciate you.
Thank you.